Hi, good afternoon. My name is Christine. Today I'm going to be recording my soap note on my patient who came in for neck pain. So today's topic is a musculoskeleton. So I'm going to be recording a patient who has musculoskeletal issues. So my patient's name is AB. His initials are AB. He is a 28-year-old male. He comes into the clinic. He was seen on March 9th, 2026. He comes in by himself. He is Hispanic and he is a him, right? He's born on August 18, 1998. So chief complaint is that he has neck pain for a whole week, and on Monday when he came in, he was complaining that it had gotten worse. Right, so my HPI is a 28-year-old male seen in office who presents to the clinic with neck stiffness, pain, and limited range of motions for about a week. He said that the pain, like his pain that is tight, especially in the posterior neck. So he was saying like the pain was it really hurts here and has limited range of motion. He can't turn his neck side to side. And he said that when on that day he came on Monday, he said the pain was like a 6 out of 10, and had to use a folded towel just to come here to the clinic because like it's just so painful to even turn and look and move around. So his job, he works as an IT tech support for an accountant firm, sitting in front of his desk most of the day, and he doesn't do much exercises. He says that he's always like hunched over, and he has been saying work has been a little stressful lately. So he didn't deny any falls, fevers, headache, nausea, vomiting, light sensitivity, any weakness of upper extremity, any numbness, and he also denies any pain that radiates to his arms. Right. So the only medication that he takes is Tylenol, PRN for pain, and he said that didn't even help him. No known allergies. He doesn't have any allergies, right? No major hospitalizations or neurosurgeries noted. Okay, so family history includes his mother has hyperlipidemia and his father has hypertension. Social history, he denies smoking and drinking. He just drinks occasionally with friends, but he doesn't smoke and he doesn't drink often. He just socially, maybe 1 or 2 drinks when he's out with friends. He lives with his girlfriend who work and then his job is an IT for an accounting firm. Exercise wise, he said that he walks a little bit, but he barely does any exercise for himself. When he gets home from work, he just lays down and just plays more, watches more screen. So he doesn't take breaks or postures. He just always on the computer in front of the screen for most of the day. Okay, so my ROS is that my constitutional is that he denies any fatigue, denies any weight loss, denies any fever. His eyes are normal. Cardiovascular wise, denies any chest pains or palpitations. Pulmonary wise, denies any shortness of breath. Musculoskeletal, right? So neck pain that has been going on for a week. He's unable to move his neck from side to side, but can put his neck down to his chin, right? Very slowly, but he can, right? Neurologic wise, he doesn't have any numbness or weakness on the upper extremities, and he doesn't have any reduction in reflexes. So his blood pressure, his vital signs include his weight is 135, his height is 5'7", his temperature is 98.5, his blood pressure is 127/88, his pulse is 88, and his respiration is 20. So physical exam, I assessed this patient. The physical exam shows that he is awake and alert and oriented ×4. He appears well nourished, regular rate and rhythm with S1 and S2 with no murmurs heard. Lungs are bilaterally clear to auscultation. Right, so musculoskeletal wise, he does have limited cervical range of motion, especially with side to side movement. He said that when he does like look on his side, it really hurts, especially on his left side. Muscle tightness along his trapezius area. So pain is reproduced for when there is a side-to-side neck movement. So when I had him turn his neck side to side, he said the pain is reproduced. Okay, so there's no tenderness in the midline of the cervical spine. The Kernig sign is negative, and the Brudzinski sign is negative. So we to rule out any meningitis, right? So neurologic wise, he's awake and alert oriented times 4. He has bilateral and equal strength on upper extremities, 5 out of 5. He has full sensations intact and reflexes are normal. Psychiatric wise, he appears well groomed, calm, and cooperative. So my differential diagnosis is cervical muscle strain due to poor posture, ICD number 10S16 1XXA. Cervical muscle strain due to poor posture, increased computer use, and living a sedentary lifestyle. Number 2 is cervicalgia. That's ICD 10 M54.2. So that's the narrowing of the cervix, the cerebral vertebrae. And then the last one, my last differential diagnosis is cervical disc disorder with ICD 10 M5020. It can be could be a bulging disc in the cervical area of his neck, right? So, but he is negative for like any tenderness. He is negative for he just has like limited range of motion when we touch this area of his neck. It could be due to poor sleeping. It could be due to sedentary lifestyle, poor posture. It could also be due to like not getting exercises, or not getting stretching, not correcting his posture, and always on the front of the computer. So my first diagnosis is cervical muscle strain. All right, so my plan for him is to continue the Tylenol PRN, but we're gonna add ibuprofen over the counter PO every 6 to 8 hours as needed with food if the pain is very severe, and to reduce inflammation. We're also going to order some cervical x-rays to rule out cervicalgia and any disc bulges. Referral is to physical therapy to help him focus on strengthening his neck muscles, improving his posture, and helping him like practice proper ergonomics. When I saw him in clinic, I told him to do some exercises on his neck. I told him to massage his neck. My preceptor and I told her to massage his neck like this and make sure that his neck is he like releases the tension off of his neck. And we showed him, and he felt like a lot better. He was able to move it. He released some tension off of his neck once we started doing the exercises. So our plan is to do education. We demonstrated neck exercises for him, gentle massage, as well as gentle neck exercises and range of motion. He was able to do the exercises, and then once we helped him, he felt like a lot better, and he was able to move his neck a little bit better with a little side-to-side motion after we did some exercises, right? So he says less stiff. So we also educated him on putting a warm compress on the area for about 20 minutes a day, maybe 3 to 4 times a day until the pain is relieved. Also to educate the patient to adjust his posture and adjust his workstation so he can have a proper posture and ergonomics while he's working, and also just to take a break, maybe like a 10 to 15 second break to stretch his back, his neck muscles. We also educated him to do some strength training exercises once he feels better to help strengthen the back of his neck. And we also educated him to do stress relieving exercises throughout the day to reduce muscle tension. Lastly, we follow-up is like we educated him to follow up in a week to discuss any cervical x-ray results and to monitor any progress. Okay, so he said that he will go to the walk-in x-ray and he will get his x-rays done as soon as he can, and then he is able to go through to that, and we'll discuss that in a week. So my reflection is, I do suffer from neck pain, but I do find myself finding, like slouching over. So I can relate to this patient. So I exercises, stretching your neck. I'm doing some back exercises, especially like upper body exercises helps a lot, reduce the pain. Also proper ergonomics, and also teaching him about like just taking a break, not always being in front of the computer, but just go outside and just go walk, and just enjoy the scenery for a little bit. Give your eyes a break, because sometimes the eye strain can be related to the neck pain. So that's my reflection, and I once we demonstrated exercises, he was able to feel better and have more mobility. So anyways, that's my soap note for the week. I hope you guys enjoy it, and we'll well, thank you so much for listening to me discuss about my patient. Bye.